Let's talk about how does a patient with primary sclerosing cholangitis, what are the histological findings in a pathological specimen which we have. Now, one important thing here to discuss is that the liver biopsy is not a recommended procedure for primary sclerosing cholangitis. The patient can be diagnosed without a liver biopsy. It is one of the fewer disorders of the hepatic system in which we do not need a liver biopsy to definitively diagnose the patient. But if the liver biopsy is performed, and then what will be the findings on the histological specimen? As we talked about that there will be sclerosis and inflammation. So as you can see in this picture, the first, let's look at the right. This is on the right side. This is a bile canaliculi presenting to us lined by the various types of cholangiocytes. So as you can see that there is a sclerosis or inflammation surrounding all over this bile canaliculi. It can lead to narrowing of this disorder of this bile duct. As you can see here that there is sclerosis in the underlying part as well, and then just as described by the arrow, sclerosis all around this bile duct, and this can lead to narrowing of this bile duct. It can lead to narrowing of the other bile duct. As you can see, one of these bile ducts, it is compressed, the other one here is compressed. So this is what we call the onion skin pattern. Just like the peels of an onion, just like an onion has various peels, on the histological specimen you are going to see these onion skin pattern in the histopathology. So this is the hallmark of primary sclerosing cholangitis. Again, this is not required for the definitive diagnosis, but this is performed in those patients in which the diagnosis is indeterminate, and we are basically considering 2 or 3 very closely related disorders. So this can be a diagnostic test in that patient population. Otherwise, generally when we do an ERCP or an MRCP, that is good enough to establish the diagnosis.